Welcome to Straight to the Point. I'm your host, Representative Joe Diorsi. In a world of long-windedness, I'm here to deliver you the capital news in 10 minutes or less. So, let's get straight to the point. So, welcome to the Straight to the Point podcast. This is Representative Joe Diorsi, and I am joined by Jonathan Wolfson this morning. He's the Chief Legal Officer and Policy Director for the Cicero Institute. Jonathan, thanks for joining.
Thanks so much for having me, Representative.
So let's start with the Cicero Institute. Of course, I've heard of it. It's an important think tank. But for the sake of my listeners, what are some of the things that you guys study, you advocate for, the policy initiatives you promote?
Yeah, we're a think tank headquartered in Austin, Texas, that works with state legislators and governors around the country, focusing on transparency, accountability, and fostering liberty with those states. And we focus mainly on healthcare, public safety, regulatory reform, and education and workforce policies, and have had the privilege of working with representatives and governors in about 30 states around the country so far in the 5 years that our organization has been in existence.
Okay. And today we're going to be talking about the physician shortage. It's an acute problem in Pennsylvania, certainly a widespread problem across the United States. But let's start with the problem. When we talk physician shortage, we read it in newspaper headlines. We're somewhat aware when we visit the doctor's office or wait for a procedure. But let's get down to brass tacks on that. What exactly are we looking at? Where are we now? Where are we headed if the projections hold true and we don't correct this?
Yeah, as you mentioned, there's a doctor shortage, and this is a national problem. The projections are that we're going to be short around 100,000 some doctors over the next decade around the country. Pennsylvania, about 1,000 doctors or so short in that same period. One of the biggest challenges is that, and it's a good thing, people are living longer, but people are living longer, and that includes doctors living longer, but they would like to retire like everybody else. And we don't produce enough folks coming out of medical school to meet the growing demand as our population as a whole gets older. People who are older tend to need more healthcare services. And so that means that the number of doctors and the number of patients just is becoming less and less of a match. And there's also some work-life balance issues where now a lot of doctors want to have time to spend with their children. And that's great. They want to be good parents. But unfortunately, that for patients means that those doctors may spend less time treating patients. And what does that actually mean on brass tacks? That means not only when you call the doctor, you go in, it might take an extra 15 or 20 minutes. It often means that folks, especially in rural areas, call their doctor and say, hey, I'd like to come in. And the doctor says, I can get you in 6 weeks or 6 months. And for a lot of conditions, that 6 weeks, 6 months can be the difference between early detection and finding out that you only have a few months left to live. And so for patients, this really does matter. And for kids who need access to medicines because they may have a mental health issue or they need mental health counseling, those kids aren't able to get access to their doctors, or adults who need that aren't able to get it. And so for patients and everybody in the country, this is a real practical challenge. And it's one that there has not been a national conversation on, but states really are taking a lead on trying to address this shortage that's going on across the country.
Yeah, so let's shine a little bit of a spotlight here on the state of Pennsylvania. I'm looking at some statistics here. Ranked against other states, Pennsylvania's doctor-to-patient ratio, which of course would impact the level of care one could offer, 35% worse on average in pediatric internal medicine, 21% worse in preventative medicine, and 176% worse in pediatric cardiology. And I'm looking at a map here which states that 32 of Pennsylvania's 67 counties are in what are called health professional shortage areas. And Jonathan, as I'm looking at this map, it seems like a lot of these HPSAs fall in rural counties. Can you comment on that?
Yeah, so, a lot of folks coming out of medical school, they have opportunities to go lots of different places. And if they happen to be from urban areas or they've got friends or spouses who need to work in a more urban area, they will choose to go there. And so rural medicine is one of the places that the physician shortage has really had the biggest impact. And so there are places across the country, when Iowa looked at this challenge, they realized that they had a vast majority of their counties without a single OB in the entire county, meaning that people who were going to have a baby definitely couldn't see care close to home. And that creates its own set of downstream challenges. And so for rural areas, this problem is even more acute than in the urban areas, although the urban areas are facing these shortages as well. And we're seeing more and more urban areas where people are calling in and finding out that it's going to take 6 weeks, 6 months before they can get the care that they need.
Yeah, so the good news is there's a solution in Pennsylvania if the legislature acts. Now there's a couple of angles. We talked just the other day about the angle of allowing a little bit more flexibility and authority with nurse practitioners. That's one option. But the other option, I actually talked with Dr. Jose Serrano, who's a constituent of mine, who brought this new idea for a solution to my mind several months back. I actually had him on my podcast. It's the solution of there's a redundancy with doctors who are from a foreign country, and they do their residency there, and then in almost every occasion they have to redo their residency if they choose to practice in the United States. Now that seems redundant to me. Can you kind of add some color to that and maybe fill in the gaps where I missed?
Yeah, and Dr. Serrano is a great guy, and he is a huge advocate for addressing this redundant training. And if in the United States we offered lots of training and lots of people could get it, but there were lots of open seats to do it, then maybe we would say, well, we want to make sure that our doctors have a standard of training. The reality is we've got about 1,000 kids who graduate from medical schools in the United States every year who don't match into a residency. And so by requiring doctors who are licensed outside the United States and been practicing for a number of years, who've done residency outside the United States, to then take a residency slot in order to practice here, we're either preventing them from coming altogether, or we're having them take a slot that a kid coming out of an American medical school would otherwise be able to get. The story I love to tell people is there's a doctor in Idaho who, before they passed a law like the one Dr. Serrano was talking about, he spent half of the year in Brazil as an orthopedist and then half of the year with his family in Idaho. He was the team doctor for the Brazilian soccer team. But in Idaho, because he hadn't done residency in the United States, we weren't going to let him touch anybody's knee in the United States because theoretically that would be dangerous. I'm pretty sure if you can fix Ronaldo's knee, we're not going to have an American knee replacement that is going to be too complex for you. And so I think that this is one of those situations where Dr. Serrano and others recognize that there are highly qualified doctors around the world who would love to come, or who might already even be in the United States, who are not able to care for their neighbors because we require them to repeat this residency training. And for a lot of them, it's just not worth going back and being a baby doctor after they've spent decades in practice somewhere else.
Yeah, and this is a very sensible argument, and it's quite bipartisan. I mean, we talk about bipartisan a lot here in Harrisburg. Sometimes an initiative is truly bipartisan. Sometimes it's kind of just smoke and mirrors. But a pathway like what you're talking about exists in red states in the country, blue states and purple states. Red states like Louisiana and Florida and Tennessee, purple states like Virginia and Wisconsin, and blue states like Connecticut and Illinois. So there's states of all types, of all political backgrounds, embracing this concept. Can you talk about that and maybe the momentum we see here in the Mid-Atlantic?
Yeah, when we first started talking to legislators about this issue, it really came up because they brought this physician shortage and were looking for solutions. And as of 2022, no states in the country had a pathway unless you were working at an academic medical center. There's long been pathways for those folks, but if they were on faculty. But once we started having these conversations, and it wasn't just us, there were lots of great other organizations and folks like Dr. Serrano who were having these conversations, we realized that folks across the country, the physician shortage doesn't only affect conservatives or liberals, and it doesn't only affect people of one gender or race, it affects everybody. And legislators were looking for a solution, and this really was a solution. And so you've got states as diverse as Massachusetts and Florida who are embracing this. And Tennessee was the leader. They were the first state to pass a pathway. And quickly behind them over the last 2 years, We've now gone to 10 states that have laws on the books, and there's about 23 bills pending around the country right now. And obviously, as you know, some states' legislative sessions haven't even started yet. And so we expect to see a large number of states have laws that would create a pathway, still under the supervision and direction of the state medical board, but giving doctors a provisional license pathway where they have to work for a healthcare facility in their state. They spend a couple of years, 2 to 3 typically, in practice at that facility. And assuming that their practice has been high quality and they've done a good job, then that license converts to a full license. And then they can be part of the care delivery service for their state all years going forward.
Yeah, so lightning round question here, and playing devil's advocate, because we are looking at this topic in Pennsylvania. What would you say to folks who, they're loyal to their doctor and they're a little bit concerned about a doctor that might be trained in a country where the standard might be not as high as the American medical system, and that they're a little bit worried about a degradation in care?
So first of all, about a third of doctors in the United States already go to medical school outside the United States, and quality of care has not changed by putting those folks through our system. Second, the medical board remains in control of maintaining the protections for the patients. And finally, and I think this is the most important part of this legislation, the requirement that these provisional licensees work for a healthcare facility. They would work for something like UPMC in Pennsylvania. They would work for a large hospital system or a federally qualified health center or small clinic. Those facilities are not going to take the legal risk of putting somebody on their payroll and letting them touch their patients unless they are highly confident that that person is going to be able to be capable of delivering high quality care. And I think that those 3 things really do give me confidence that this policy is going to provide access to care and not going to lower the quality of care for patients.
Yeah, so he is Jonathan Wolfson. He's the Chief Legal Officer and Policy Director for the Cicero Institute. And this is a novel idea to address the physician shortage. And Jonathan, I thank you so much for coming on my podcast today, and I'm sure we'll talk soon.
Thanks so much, Representative. Have a great day.
This has been Straight to the Point. Visit repjod.com/mypodcasts.